Hello everybody, this is second video in the series about pediatric flatfoot. If you did not see my video about the 7 truths about pediatric flatfoot, I encourage you to go ahead and watch that video. That's on my YouTube channel. Please subscribe to that. That talks about the 7 truths about pediatric flatfoot. Now, in this second video, we're talking about pediatric flatfoot that have to undergo surgery. Now, remember that not every child with a flatfoot will require surgery. Only those that fail to respond to conservative care, such as physical therapy and custom orthotic treatment. Now, I get parents asking me, can I do the Dr. Scholl's inserts or the inserts that they buy at the shoe store, or these custom inserts that they buy at the shoe store? Well, the answer is no. Those do not count as custom orthotic management for the ones at the shoe store. They're really not customized. They're over the counter, and the best way to compare and contrast is you get reading glasses at a drugstore versus getting glasses from a optometrist or an ophthalmologist. That's a huge difference. You wouldn't get over-the-counter dentures. So these are very patient-specific and very customized to your child's feet. That is what counts as orthotic therapy. Now, for those who fail real orthotic therapy and physical therapy and conservative treatment by your pediatrician or orthopedic surgeon, then we go ahead with pediatric flatfoot reconstruction. There are many different procedures, depending on the child's age as well as where the deformity is located. Now, I will present a case today about a 17-year-old child who is very active, but had very much difficulty with activity. Now, this child and the child's mother has been complaining to the pediatrician for quite some time about pain in the child's foot, but chalked it up as growing pains, or the kid will grow out of it. But the kid is 17. So they found our office through referrals from friends, and he did have very flexible and painful flat feet. In addition to that, he was starting to get symptoms of shooting pain down the ankle, as well as an actual tendon injury from the severity of his flat foot. An MRI was ordered. One of his tendon had tears in it. So by the time a child gets to complain this much to the pediatrician, as well as the mother complaining that child can't be as active as they want to be, and having pain in the ankle, that child's needs should be addressed. So a well-certified pediatric physician, as well as a pediatric orthopedic physician, should be able to give you an assessment. Now, this case that I'm going to present is a 17-year-old child. Like I said, on the one ankle, he has a severe pain, deformity, and tendon injury. This is what happens when they go neglected. On the opposite foot, he was starting to get these symptoms. So we decided to go with a more conservative route versus a large surgical reconstruction. Now, the other side did not undergo the tendon injury that the first side did. So keep that in mind. So there's many different ways to address a pediatric flatfoot. It all depends on the severity and what stage we have to go to address this deformity. It could be as easy as sticking in a metal or absorbable implant into one of the joints in the back. Sometimes that is sufficient enough to address the condition when it's minor, to having to repair the tendon and reconstruct the arch from the heel forward. So I hope you enjoy this video and enjoy this explanation. Any questions, please subscribe to my channel on YouTube, as well as go ahead, post comments and questions. I'll be glad to entertain them. We also have a Facebook page, Family Foot and Leg Center, P.A. period. This young 17, almost 18-year-old kid here, almost a man, a few more months, He had Flatfoot Reconstruction. This one was more of a more advanced reconstructive. The Evans osteotomy was done on the side here. So you can see the incision was made right here. Bone graft was placed in. This was done because he had a severe injury to the posterior tibial tendon as well as severe collapse. That's why you have this incision right here for me to repair the tendon. So he came to me a little bit late in the disease where he's already having pain, debility, inability to play sports, and a lot of complaints. But mainly a severe collapsed foot with bad tendons. So that's why I have to fix the tendon and put a bone graft in on the other side. Now fast forward. Now this one is fully healed. We fast forward to this side where I put in a joint implant instead because we caught this early. It was flat, but it was not quite painful yet. It was a little bit just uncomfortable, but not quite painful. There was no tendon involvement on this side. So for the young man, right now he has nice arches on both sides. I'm gonna have him stand up. But how do you notice about the recovery of this one versus that foot? This is the bigger procedure versus that one, the implant. Was the recovery easier on this side? Same?
I think both really were the same. The right one a little faster than the left one, but overall they were the same.
Okay. And what kind of activities are you able to do now that you were not able to do before the surgery?
Well, now I mean I'm able to participate in like general most of the sports. Like I'm playing football with my friends. I can sprint now on track, things like that.
Okay.
Yeah, I can run. Basically.
You can run now. Well, how about you can walk without pain?
Yeah,
how's that, right?
Yeah, that too.
So, Mom, are you happy you finally had it done?
Yes.
Yes.
We're really happy.
I know, poor kid. He was having so much pain. So, let me have you stand up. This is the young man again standing for us. This is the side. This is the side with the tendon repair, the more complex repair, and the arch repair with the bone graft on the outside. You can see he has a nice arch now. This is the side right here where we just did the implant. You can see the arch is a little bit higher because he did not fully collapse on this side before we did the intervention. And he's able to fully use both feet. He's able to run. He's able to do his activities. His toes are no longer curled. He's not gripping the ground. So he's back to regular activity. Any suggestion from Mom or a patient here about people that have flat feet that are painful?
You have to take care of them much earlier. You know, go to the doctor earlier, not wait till you get like ready to the point where it's so painful you cannot do anything.
Yeah, would you agree on that? I mean, you were in a lot of pain when I first met you.
Yeah.
So finally we have you straight now. So awesome. So good. Well, I'm glad you had an excellent recovery. This will be with you for the rest of your life. You'll be able to use your feet, go about your activities, play football, etc. Okay, big guy.
Yeah, thank you.
Yeah, you're getting there, man. You're a big kid.